Thank you, Madam. Madam, let me first start by thanking all the doctors, nurses, and other healthcare and frontline workers in India and, in fact, all over the world in their continuing service to humanity. Madam, it has been 2 years since the start of the pandemic, and we have learned much about this virus, its prevention and its treatment. We have also learned about the impact of actions taken and actions not taken by governments, institutions, and by people at large. Each variant is teaching us new lessons, Madam. The first wave, fueled by the Alpha variant, exposed our weaknesses in health infrastructure, the shortage of beds, ventilators, and PPE kits. The second wave, fueled by the Delta variant, showed us that we have a weakness in oxygen supply, medical-grade oxygen supply. Even though we had oxygen available in steel plants, we couldn't put them into cylinders and get them to where the people needed them, Madam. The first wave, Madam, also taught us to take people into confidence and give them time to prepare for extreme measures like lockdowns in order to avoid humanitarian crisis. We've also seen the economic impact of the lockdowns and travel bans. The percentage of people below the poverty line in India has gone up for the first time in the last 40 years, Madam. Now we are facing the threat of a new variant of concern as designated by the WHO, the Omicron variant. I believe we need to take both a cautious and a considered approach in dealing with this variant, Madam. We cannot take it lightly, nor can we use blunt instruments like lockdowns and travel bans, which have huge economic consequences and may even lead to more humanitarian crises. With vaccination levels improving, we are better equipped in dealing with new variants than we were during the first two waves. If there is indeed a third wave, I believe we can deal with it without imposing lockdowns or travel bans, on vaccinated people especially. Quite a few countries are planning to or have already stopped international flights. The WHO has already advised against implementing such blanket travel bans, as it may not prevent the international spread. In addition, it warned that such steps can adversely impact global health efforts during a pandemic, as the countries may be hesitant to report new cases and to share medical data. As per initial research of health experts, it is seen that this variant has 50 mutations overall, including more than 30 on the spike protein alone. Another research in a medical journal indicated that the number of antibodies reduced by approximately 57% after 6 months of inoculation of the COVID vaccine. Keeping in mind the new mutant variant, as well as the reduction in the amount of antibodies after inoculation, what is the strategy of the government to protect the people is what we want to hear from the minister. Is the ministry considering and formulating a strategy for administering booster doses to those who have been fully vaccinated? If not, what is the ministry's plan? May kindly be explained. I think the government of India has started vaccine exports again from last month, and I'm given to understand that about 25 million vaccine doses have been exported to various countries. So I request the Honourable Minister to immediately stop the vaccine exports and let the days of giving 2.5 crore vaccines in a single day come back, and let us continue to ramp up administrating the vaccine, since it is the only protective gear we have right now. Madam, the Honourable Minister talked about preparedness and said that the country is well prepared for any eventuality. But I would like to know from the Honourable Minister one thing. The Government of India has proposed to set up medical oxygen plants in various states of the country, including one at Guntur Medical College in Andhra Pradesh. What is the status of oxygen plants in the country, particularly in AP and Telangana? I would like to know, Madam. Also, at this point of time, instead of jumping the gun and creating panic among the public, a strong message needs to go into the public that we strictly need to adhere to COVID protocols of wearing masks, maintaining physical distancing, and sanitizing our hands regularly. Efforts should also be made to ramp up vaccination and addressing the problem of vaccine hesitancy, as following COVID protocols and vaccination are time-tested ways of containing the spread of the infection. The government also needs to be diligent in the 3 T's: tracking, testing, and treating. I would also like to reiterate the need to take a quick decision on booster doses for the fully vaccinated, and starting the vaccination for those below age of 18 years to ensure that the country is protected. These are some of the issues I thought I should raise before the Minister, and I request him to kindly let the House know what the Ministry has planned. Thank you, Madam, for giving me this opportunity.